Hi, Dr. Lamoreux.
Hi, Dr. Henniger.
So, we are here to talk to you. I'm very excited to talk about bioidentical hormone replacement therapy, which you are very well versed in. We're all learning more about this as we bring it to patients. So, tell me about it. What is it? Like, just describe it.
Yeah, so bioidentical hormone therapy is
Mhm.
essentially taking hormones that are made to look exactly the same as the
Mhm.
hormones that we have in our body,
Yep,
and supporting low levels to improve health.
great. Easy enough. Estrogen, progesterone, testosterone primarily is what we're talking about. So.
Yes, exactly.
Um, so what were the reservations about this? I know we get a lot of patients who are concerned or have their primary doctor concerned. There was a women's health initiative years ago which drew some conclusions which have turned out to not really be applicable to our present day circumstance. So
Yeah, so the
yeah.
Women's Health Initiative, um, uh, had some findings that there could be some adverse health outcomes for hormone replacement therapy. However, since then, kind of reviewing the data, like looking over that, we've changed our tune essentially.
Yeah.
And a couple problems with the Women's Health Initiative study. One of them was that they were using synthetic hormones. So not they were not bioidentical. They were not bioidentical estrogen, and it was not bioidentical progesterone.
Sure.
And so when we're talking about using bioidentical versus what was used in the Women's Health Initiative, the bioidentical hormones have much better safety
Yeah.
uh, in their use.
Yeah. Better safety profile. And one of the great things about the way that you practice and the way we practice is, everybody's individualized. Obviously, there are people who, aren't as perfect candidates for this, but most people are at this point. And so we'll talk a little bit more about that. But what does somebody who comes to you for this, what are they symptomatic of? Like, what's the age range? Like men, women, like how do you describe that?
Yeah, it tends to be 40s and up,
Hmm.
although there are exceptions to that. And as far as women are concerned, we see a lot of hot flashes, a lot of kind of changes in sleep,
Hmm.
changes in weight, changes in mood, changes in energy levels.
Yeah,
And so we like to do a comprehensive look at that and get lab testing and see
yeah,
what's happening with these hormones, and then see what could be adjusted in a way that would help those symptoms.
yeah. And it seems like when we're looking at the data, starting this sooner in the process of perimenopause or, kind of, or as close to menopause as possible has the greatest outcomes and,
Exactly.
which is great. So that's interesting. So how would you describe your approach, like the Flora approach? How do we go about this? Somebody comes in with these sets of symptoms. Where do we start?
Yeah, so we have a initial visit, and we spend our first visit, we spend an hour and go over your whole health history, and any symptoms that you may be experiencing. So it's really a holistic approach. In
Yeah.
our world, everything is connected, so we want to get as much information about all these different things as we can,
Mhm.
and then kind of from there, we want to choose some lab testing that makes sense
Mhm.
to kind of make sure that the issue actually is low hormones.
Yeah,
You know,
right.
it's certainly possible that someone comes in,
Yeah,
they're like, yeah, I think I need hormones, and then their hormone levels are actually really good, but then we find some other issue that may be
true.
causing the problem.
Right, right, right. Exactly. So super individualized, for men and women, and from there, we get hormones started, and people feel good right away, right? This is not something you have to wait, to get an effect from, right? It's pretty immediate.
Some of my favorite things about it is that people feel better and notice improvements
Yeah,
quickly. So yeah, that's
yeah,
exactly right.
yeah. Symptom resolution. That's where we're at, giving people their quality of life back. You don't have to suffer anymore through these
Yeah.
transitions, which is, pretty awesome. So.
And that being said, I would expect to have a little bit of time to
Mm.
dial into the optimal dose for you.
Right, right.
And people notice benefits quickly, but then we kind of got to get that custom dose that works the
Mm.
best for your body. and that for looking at long term. So
Yeah.
that's part of why we want to follow up and make sure that everything is going
Yeah.
according to plan and make
Yeah.
any adjustments needed and
Yeah.
get the best outcomes.
Yeah. And one of the great things about the way that you treat patients is that you are a naturopathic doctor, right? This isn't going to your gynecologist or your endocrinologist. Like you're looking at everything. And we also have a huge toolbox of naturopathic therapies that support this. So it's like, often you're not doing this in isolation, right? You're doing,
Yeah.
adrenal or diet and all those kind of supportive.
Yeah, nutrition, blood sugar,
Yeah.
making use of herbal medicines when that makes sense. Yeah,
Yeah. Yeah. They
exactly.
all, they segue nicely together, which is really integrative, full body approach. So it's
Yeah.
awesome. Good. All right. Thanks for being with me.
Yeah.
Thanks.